Hi, my name is Melissa Butemeller, and I'm a senior at the University of Missouri in the Sinclair School of Nursing. I'm due to graduate December 2016 with a bachelor's in nursing. As an aspiring nurse, I have many goals, one of which is to obtain a job in the neonatal intensive care unit at the University of Missouri Hospital Women's and Children's. As just a senior in high school, I earned the opportunity through a health sciences club to shadow in the NICU at the Women's and Children's Hospital here in town. Little did I know that this opportunity would open my eyes to a passion that I would soon go on to school to pursue. During my OB clinical rotation this past semester, I was able to shadow a nurse in the NICU for a day. Keeping in mind that even though I was in this same place 4 years ago as a high school student, this time was very different for me. I wasn't a high school student aspiring to be a nurse anymore, but I am a senior nursing student who will one day become a NICU nurse. I also learned that there are many differences between the patient population in the NICU versus anywhere else I have experienced. There's an obvious communication barrier, which can make nursing for these tiny, nonverbal humans challenging at times. With this quick realization, I became driven to learn how I can better myself, not just as a nurse, but as a nurse specific to neonates who need someone who can advocate for them in such times of critical need. After having been a nanny for 4 years, I was able to learn how to communicate effectively with little ones and newborns. With the knowledge I have studied and experienced throughout my OB and pediatric clinical rotation, I was able to apply the nursing and communicative side to the foundation I had built with my many years of nannying. Another important point I discovered was that I would not just be fighting for the babies in the NICU, but I would be caring for the family as a whole, who has waited desperately for these tiny babies to come to the world. Taking care of these babies in the NICU would not just be a job to me. It would not just be a career, but taking care of these babies in the NICU would be a privilege and one worth tedious studying and clinical application to be the best provider for the family as a whole. As a nursing student, I have learned that a critical part of the schooling process and clinical experience is to discover your niche. With the opportunities I have been granted, I am confident in saying that I believe the NICU is a place where I can provide quality patient care to such critical patients. While improving my skills as an individual, a nursing student, and a nurse, I look forward to having the opportunity to apply these strengths to a team of NICU caregivers and well-deserving patients who are of such beautiful potential.